He had no non-systemic disease but was chronic alcoholic. On general examination, patient had high-grade fever and presented with tachycardia. There was no significant findings on systemic.
No, sir. We didn't research it, sir. It was there in post-operative 2 and 3, but after that, because of the fibrin clot and everything, it got.
So you mean to say that the graft came back to its original position, your intended position, after displacing?
Yes, sir. In minor.
Phacoemulsification with posterior chamber intraocular lens implantation has been the most widely used surgical procedure. Cumulative dissipated energy, or CDE, is the total energy dissipated during phaco and represents the energy needed to destroy the lens. It is defined as percentage second, that is the average phacoemulsification power multiplied by phacoemulsification type.
To know the spectrum, the type, the nature and mode of the ocular trauma, all the patients attended in Jennings IOPD emergency and also referred from other surgeons were included. The study was a hospital-based observational study conducted in Jennings within a study period of 3 years. Total case of 215 were observed.
20 to 50 years of age, having predilection for women. The pathological basis lies in an abnormal corneal endothelial cell layer with a predilection for proliferation and migration across the anterior and intertriangle and onto the surface of the iris with subsequent progression to glaucoma and corneal desensitization. PCR testing has shown positive.
Optic CD ratio was
0.3.
0.3. So advanced cupping you said in the right eye. And you said that regarding the fixing the plate of the glaucoma drainage device that you use 80 Vicryl for that. But as far as I remember, 80 Vicryl is a absorbable suture. So is there any chance of the plate migrating maybe posterior?
It can be active by intracameral mydriatic agents or by topical mydriatic drugs. The objective of my study is to determine the efficacy and safety of intracameral mydriatic injection as compared to pre-operative topical mydriatics in manual SICS. It was a hospital-based randomized control study done in the Department of Ophthalmology, RIMS, in a period of 2 years in all the uncomplicated cataract patients who attend RIMS ophthalmology. Sample size was 42 in each group, 292, which is statistically not significant. And this is the table for the comparison of AC inflammation score between the intracameral group and topical group having higher grades of inflammation. The prevalence of pterygium in India is around 12.6% in adults. The aim and objective of this study is to assess the surgical time, the ease of surgery, and compare the post-operative outcomes such as patient discomfort, reoccurrence rate, and cosmetic satisfaction in patients of primary pterygium excision that underwent superior conjunctival autograft versus inferior conjunctival autograft. In day, 50% of the patient in group A and 30% of the patient in group B experience foreign body sensation. Superior lobar conjunctiva is preferred because of the maximum limbal stem cell density present superiorly and the bare area is covered by the upper eyelid. While in inferior, it's preferred in a patient who had a history of glaucoma surgery or there is a possibility.
There is high prevalence of CMV retinitis in patients with CD4 count less than 100, and CMV retinitis is a leading cause of blindness in HIV and AIDS patients. These are the pattern of transmission. The current population of Manipur is 37.56 lakhs, and prevalence of HIV, according to NACO, in India it's 0.21%, in Manipur it's 1.05%. Aim of the study is to see the prevalence of CMV retinitis among HIV patients, to understand HIV and CMV retinitis relation, and to see the relationship between CMV retinitis and CD4 plus T cell count. 300 one yearly. Annually.
Did you check for syphilis?
No, sir. We didn't check. Thank you.
Okay, can we have the next speaker, Dr. Lakshita Nara?
Good afternoon, everyone. The topic of my presentation is a cross-sectional study to determine the relationship with HbA1c and different grades of diabetic retinopathy. The objective of my study was to determine the relationship of central corneal thickness with the severity of diabetic retinopathy and HbA1c level in type 2 diabetic mellitus patients. It was a cross-sectional study conducted in the Department of Ophthalmology RIMS and was conducted for 2 years. All type 2 diabetes mellitus patients attending the ophthalmology OPD satisfying the inclusion and exclusion criteria were included. 73 patients were placed in each group, the groups being diabetic retinopathy and patients with no diabetic retinopathy. Inclusion
has the age advances. Risk factors, age is the major risk factor. Other than that, genetic influences, lifestyle such as smoking, alcohol intake, sunlight exposure, obesity, cardiovascular diseases also, and alcoholization and occurrence of hemorrhages. Geographic atrophy in fundus autofluorescence, based on the autofluorescence, it can be either diffuse, focal, banded or patchy. Traditional treatment, a lot of benchmark trials have been tried and currently anti-VEGF therapy is the current treatment modality. Prior to anti-VEGF, thermal laser photocoagulation and photodynamic therapy were used, and supplements are based on ERETS studies where antioxidants are supplemented as it might reduce antioxidative stress which is a major pathogenesis.
It's basically a hypothesis, should I assume it? It's a hypothesis that...
Therapy and stem therapy is a hypothesis and they are tried only on animal studies.
Okay. So for Indian patients, what should we go for the ARMD treatment? What should we follow?
Port delivery, because it gives 6 months since the compliance of the patients to come and get monthly regular checkups, follow-up is not very compliant. I think.
Do we have sufficient literature in this?
Port delivery.
Yeah.
Yes, ma'am.
You have?
Yes, ma'am.
Thank you.
Thank you.
Thank you so much. Thank you so much, everyone. All the presenters have presented so nicely. Within a short time, we'll be presenting.
Video ne bhai di. Ai video namak bane. Video ne video.
So while the judges are taking them to the stage to distribute the certificates, our first participant that I'm going to call is Dr. Meghana Muni Reddy for her talk on recent advances in ARMD. A big round of applause, please.
Energy or the chat of Kubang Yam could have said that.
A big round of applause.
Young Karwa Wahi, Tejasina Wadi Tamastu Mavi Visha Wahi, Om San. To extend a warm welcome to everyone present today. I welcome today's chief guest, Dr. Chambo Golmai, the Health Services Government of Manipur. The turmoil we have faced, but still we have to work hard, we have to focus, we have to bring our society to a high level. Next, again, I welcome everyone and thank you.
I hope there will be enlightenment and light in our lives and empowering of knowledge and more brightness in the future of Ophthalmical Society of Manipur. Thank you so much, everyone. Thank you so much to all our respected dignitaries. A big round of applause, please.
Dr. Tonongi matangda waya manidan mayang mafamda ay haijage mahak 1983 da join torga 2005 da retire tawbuni yam te laba matamda state health service ta thabak tawbirami.
Gurus, so many, 4 gurus, 5 gurus are here, my gurus, and recognized and famous ophthalmologists of Manipur. Kaya singda manda sa kaya wabase mayam lairiba kugi guru singse loy thengnara bangantani aina Bisenpur ihan hanta bada DBCS aina district line.
Evergreen Dr. Poshpam Binata Devi, retired Assistant Director Health Services, Government of Manipur. Respected Secretary OSM Dr. Sasindra Raisram, Consultant CJ Academy of Health Sciences, Lampen Quad, Seniors in front, one-time Big Jan of
colleagues, junior mayam, media person saying, Amasung Atopa, company Gimio, Limbi able to the service to be Singoina.
Present, and there is also the problem for graft harvesting and synthetic material use, persistent megophthalmos, and there is almost 90 to 100% recurrence of ptosis in almost all of the cases, and there is also problem of severe leg on down gaze and ptosis on up gaze. So this frontalis flap, it kind of minimizes some of these complications. So before moving on to surgical technique, a brief
pathological myopia in which the spherical equivalent is -8 diopters or more, or an axial length of 32.5 millimeters or more, along with greater likelihood of chorioretinal atrophic changes. So statistics say that high myopia affects around 2% of the general population, and it is expected that by 2050, 50% of the world's population will be myopic, out of which 10% will be highly myopic. So what is the relationship between cataract and myopia? The Beaver Dam Eye Study, the Blue Mountains, the Singapore Malay Eye Study, they have shown an association between myopia and nuclear cataract, and also that there is an increased risk of nuclear cataract.